University Hospitals of Morecambe Bay NHS Foundation Trust has over 5,000 staff based on 5 sites across South Cumbria and North Lancashire. We have a range of services that provide care to around 365,000 people at all stages of life. Every year we update the entire workforce with our headline priorities using 5 clear headings. We call these our 5 strategic pillars. As you can imagine, for a large and complex organisation, there can be a lot of areas to cover. But here are some highlights for each of our pillars. We are always working to improve our performance by reducing clinical variations where possible and keeping patient waiting times to a minimum. It's been a very good year for the Trust, but not without its challenges due to the ageing population, rising costs and staffing shortages.
This pressure in ED has been quite significant over the past few months, or rather almost a year now. But as a Trust, we have taken a lot of measures to mitigate the problems we have been facing. The triage time, which we have reduced significantly. Staffing, we have looked into our staffing and we have improved our staffing level, especially for the doctors and the nurses. Thirdly, also opening up the minor injury unit, which has helped. Outside the A&E, we have done quite significant work in ambulatory care. Our discharging system has been improved significantly. We've also set up community pharmacy and also set up beds in the community for safely discharging patients home.
In order to move closer towards an integrated health and care system, we have developed new and innovative ways of working, such as using video consultations to promote quicker access to appropriate healthcare and reduce the number of unnecessary journeys to hospital. During the year, the Trust has continued to work closely with our Bay Health and Care partners, and success has been demonstrated through the delivery of our Better Care Together strategy. Through our partnerships, we've seen some outstanding results. In ophthalmology, a new scheme began where people suffering from minor eye conditions were seen by optometrists in the community. In the first 18 weeks, 1,639 people were seen. We want people to experience more consistent care. To help us achieve this, we're building 12 integrated care communities, or ICCs, that will each tailor their priorities according to the needs of the local people it serves.
We're looking to integrate care more closely across the Bay. So the ICCs are one way of doing that, bringing all the services together in a place around a natural community so that the individuals and the organisations there can prioritise services and develop services along their own needs and aspirations.
We're continuing to reinforce the importance of a healthy, happy and safe workforce through our Flourish at Work programme, and around 100 members of staff have already taken part in the challenge to move more and improve their health and well-being. At UHMBT, we believe it's important to recognise the good work of our staff with initiatives such as Star of the Month and our annual Health Heroes Awards. The Trust was the first in the UK to launch a dedicated Freedom to Speak Up app, making it easier for staff to raise any concerns.
The Trust bought an app, and we're the first Trust to have an app for staff to speak up, which means they can raise concerns through their own smartphones after downloading it for free, and they can put in a concern anonymously, or they can give details of themselves and it will be treated confidentially and to be followed up.
We launched a number of campaigns and initiatives in the last year to improve both the quality of care we offer to patients and the experience our staff get working in our hospitals, including the #BetterWithYou, helping to recruit staff, and the Baby Maternity Appeal, which is raising £250,000 to fund additional equipment, services and furnishings in the new maternity unit at Furness General Hospital. We've also continued to support employees to make the changes that matter most to them with the Listening into Action programme, reaching its 9th wave last year. Another improvement scheme that's made a real difference to the lives of many staff is the Staff Inclusion Networks.
The inclusion networks have helped staff because they have provided an opportunity for staff to come together to support one another, so there's a peer support element to it. Those staff have a genuine interest on making the staff experience better.
We're continuously improving the quality and safety of our services. We've made a number of investments over the past 12 months to help us do this, including a £1 million revamp of the Cardiac Centre at Westmorland General Hospital. Staff spirits were lifted when regulatory body the Care Quality Commission moved our overall rating from requires improvement to good, and we were awarded a rating of outstanding for care. Despite resource challenges, we've continued to invest. Our new end-of-life Maple Suite at Furness General opened, and a new coronary care unit was completed at the RLI. One of the initiatives helping to provide better quality care for our patients is the new Health Early Action Team at the RLI.
The Health Early Action Team has been employed to reduce the frequency of attending in the hospital of people with alcohol-related problems. People can choose, if they're interested in help, we can find them the help. So by doing that, then that reduces the length of stay and introduce them to support on discharge, which hopefully will prevent them coming back again.
We'll keep developing our relationships with local health and care partners to help us work together more effectively. An example of this is the new Maternity Strategic Partnership, which encourages consultants and midwives to consider placements and secondments between trusts. As part of our sustainability program, the Trust has been developing innovative ways of working that prioritise patient safety and quality while also reducing costs. One of these innovations is using volunteer blood bikes.
Started in 2012. We provide an out-of-hours courier service. Very, very simply, that's what we do. It's a tremendous saving as far as the Trust is concerned, because obviously if you had to move these things around, it's taxi fares, things like that.
We would like to thank our governors and our members who continue to support our journey and engagement with our stakeholders and the public. Thank you for your continued support.